Our natural fertility, our natural childbearing, our natural breastfeeding, that's a female body. That's what it does when it's fully healthy and optimized. Now, of course, we're going to have variations off of that. We're going to have women whose body's not optimally healthy. The solution is that we put money into research, we put money into medical treatments, we learn what the underlying causes are. We learn to understand when women's bodies aren't functioning properly, and that's what women's healthcare should be. Women's healthcare should be caring for a healthy woman's body. It should not be the suppression, the alteration, the destruction of our bodies. Because every time we tell a 13-year-old girl, well, your cycle is irregular, you're only getting your period every, 8 months, which is normal for a 13-year-old girl. That's totally normal. When we tell her, well, your cycle's not regular, we're going to put you on this artificial hormone to make your body do this certain thing, and we fail to explain to her that what her body was doing was good and healthy, she just internalized something is wrong with me. God didn't know what he was doing, or I'm just broken, I'm a lemon, something's not right. I know that young women are internalizing this. They do believe that something is wrong with their bodies. I've worked with a couple of friends as doula. I've served as a doula. I've been present in the birth room for friends. And I have seen the doubt on their face when they go into childbirth. I have seen the fear. They do not believe that they are capable of giving birth. They do not think that their body will do what it was meant to do. And then we fast forward past the birth and into their breastfeeding experience, and they are convinced that something is wrong with their breasts. They won't work. They're too small. I could never breastfeed. My mom couldn't breastfeed. My mom didn't try. My grandma didn't try. No, that's gross. That's weird. They think that it's wrong, that it's gross, that it's disgusting. Even after 30 years, our government for the last 30 years has put tremendous funding into the promotion of breastfeeding. Even after 30 years of government funding promoting the health, the breast is best, we still only have about 70% of women in our country that ever attempt. About 70% of women will attempt it. That lasts for the first few weeks. At about 6 weeks, the duration of breastfeeding has dropped off significantly to about 45%. Very few women actually make it to the 1-year mark, which is recommended for breastfeeding. Even less make it to the 2-year mark, which is recommended by the World Health Organization for breastfeeding. Because our world doesn't make room for it. It doesn't make room for the female body. It doesn't make room for motherhood. If we are going to fight for human dignity for all persons, we need to start with the women who are raising all persons. When our mothers understand and believe in their own human dignity and they can pass that on to their children, we're going to see a world changing. We're going to see dignity being passed on to every other person.